So atherosclerosis is a Greek word, and athero means gruel and sclerosis means hard. So it's a hardened substance which is deposited inside the blood vessels. And the major causes of coronary artery disease is that there is an interaction between the endothelium of the coronary arteries and these fat deposits. And these harden and reduce the lumen of the arteries so that the blood flow is decreased distal to the occlusion. The endothelium can become damaged and denuded from an increase in blood pressure, also from smoking chemicals and or diabetes. And this can begin the construction of a thrombus or a blood clot. Diet is also linked with thrombus formation. So coronary artery disease is the leading cause of death in westernized countries, and it results in partial or complete blockage or occlusion of the coronary circulation, resulting in coronary ischemia. The coronary muscle cells, the cardiac muscle cells, require a constant supply of oxygen-carrying blood and nutrients. And chest pain is reported by patients experiencing angina or MI, which you might see written in the notes, which means myocardial infarction, where part of the myocardium has actually started to die because of this lack of blood supply. So here, angina is reversible. So if the person stops doing the activity that was causing their heart in the first stages, then their blood supply is re-established. As the cardiac disease advances, then the angina can move from being stable to unstable, and the sign that it is getting worse is if the person wakes up at night and they've got chest pain. Myocardial infarction is different from angina. It is a non-reversible ischemia, which is why it's so important that if a person is complaining of chest pain, that you get them to hospital via an ambulance, not driving them yourself. So in case they do have a full cardiac arrest, you can't drive and do cardiopulmonary resuscitation at the same time. So best to dial for an ambulance. So if you haven't already, it's a good time to take out ambulance cover, because remember, if you're the nurse in the family, everybody will be expecting you to know what to do. So have a chat with the rest of the members of the family, find out what health cover everybody's got. For mum and dad who are getting older, they of course need ambulance cover. Otherwise it costs between $500 and $700 to call for an ambulance, or you can have it covered in your health insurance. The three main arteries that normally get blocked are the right coronary artery, the left coronary artery, and the left circumflex artery. Abnormal cardiovascular conditions, there are some things that we can control and some things that we can't. Some things that are called non-modifiable, so we can't stop aging and we can't alter our gender easily. Males have a higher incidence than females. If you have heart disease in your family, then there is a hereditary factor, and also ethnicity. So some ethnic races have a higher incidence than others. But there are things that you can modify. You have got control over your maintaining a healthy weight, and you have ultimate control of what goes in your mouth as an adult. Children don't have as much control because parents who are adults are responsible for what they buy for their children. You can decrease the amount of sodium in your diet, decrease table salt. You can increase physical exercise. You can have a moderate intake of alcohol. You can monitor your blood pressure so that you know what your blood pressure is. And of course, the main contributor is that you can cease smoking. We therefore do have significant control over cardiovascular conditions.